The following episode is sponsored by Centec. Carbon dioxide is an integral parameter for brain and lung protection in neonatal patients. CO2 provides an indication of safe levels of cerebral blood flow as well as the efficacy of ventilatory support for delicate lungs. Centec transcutaneous technology provides continuous, accurate, non-invasive monitoring of carbon dioxide, enabling visibility into patient ventilation status and helping to reduce the frequency of blood draws. Centec. Care with confidence. Learn, lead, and level up at NANN's 38th Annual Conference. Join us live in the heart of Las Vegas from September 14th through the 17th, 2022 for the most engaging and valuable neonatal nursing event of the year. Earn over 40 CE hours from comprehensive educational sessions, network in person with fellow nurses and APRNs, and engage in exciting attendee activities. By the end of the conference, you'll feel refreshed and inspired to make innovative changes that nurture you and transform your career and the care you provide. Not ready to travel yet? No worries. NANN's 38th Annual Conference offers virtual options so you can stream along from anywhere in the world. Visit nann.org/conference to learn more and register today. Hello, and welcome to NANNcast. I'm Jill, your host. In light of the recent events surrounding a medication error, nurses everywhere are taking a step back and reviewing their own medication administration practices. NICU patients are uniquely vulnerable to medication errors and require additional safeguards, making NICU nurses even more anxious about medication safety. As nurses, we can't let this situation overwhelm us with fear. Fear helps no one, and it can lead to even more errors, especially in stressful situations, which are quite often in the NICU. Fear stifles change. We have to create a culture where we stand up to unsafe standards and unsafe conditions that can lead to medication errors. It is up to us to stay vigilant, educate ourselves on the policies, and speak up to create change. As the professional voice of neonatal nurses, NANN recommends a comprehensive approach to medication safety in the NICU that integrates available technology, focused healthcare provider medication safety education, standardized medication processes, and a robust medication error reporting and prevention efforts. To help us calm our fears and anxiety around medication administration, I'm joined with the authors of NANN's Medication Safety Position Statement. It is my pleasure to welcome Dr. Deb Armbruster, a neonatal nurse practitioner at Nationwide Children's Hospital, Dr. Robin Keppel, a neonatal clinical nurse specialist and pediatric nurse practitioner at University of California Irvine Medical Center, and Erica Van Ewegen, clinical staff nurse at UNC Medical Center and director at large on the board of NANN. Let's get right into it. As we all know, the NICU is a very special place. Things run a lot differently than in the adult world. However, there are some of the same challenges, and medication safety and medication administration is a challenge amongst all nurses, and especially now with the new turn of events that have been happening. And babies have such different medication dosages. We have special calculations that we have to do, everything being weight-based. There are some safeguards in place, but, we could do more. So I know NANN created the position statement on medication safety. So, Robin, can you give us some more insight into how this position statement was developed and what were your focuses for the position statement?
Hi, yes. In 2011, there was a position statement already in existence on the NANN website. And in 2013, I was contacted to revise that statement. So Deb and I, and a group of other nurses, NANN members, came together and revised it. But again, another revision due in 2021. So that's what's reflective today is the latest updated published research that sort of supports medication safety in the NICU, and it's very unique and challenging system in the NICU where our babies are nonverbal, so they can't participate in safety. We also have weight-based dosing, and often we're using adult strength medications. And I think pharmacists are so integral in the safety of medications in the NICU, but not all of us have all the same resources in all our NICUs. So we really wanted to highlight what we thought would be best practice for medication safety in the NICU and serve as a resource for NICU RNs across the country to use this document to help them advocate for safe medication in the NICU.
When we're talking about medication safety in the NICU, we need to remind nurses that there's a lot of safety measures that they can use. They can use their peers. They can use some of the technology that's out there if it's available to them. Follow the system prompts. When you're giving a medication, follow your 5 rights of giving a medication. Even though the patient is nonverbal, there should be some kind of medication or a patient identification marker to be able to proceed with the medication administration. And the other thing that I really want to highlight is if nurses say that, if something is not correct, they need to speak up. They need to ask their peer, they need to ask their provider. So to ensure that the medication administration is safe for the baby. Our babies are very fragile, they're small. Medications based on weight, medications are based on gestational age, and there's a number of reasons why we need to be very careful and follow a process when we give administration of medications in the NICU.
I love that, with powering nurses to speak up. And, if something doesn't seem right and you question it, question it. And, if it's not right, it might not be right. And you have so many resources, not just the pharmacist, but you have your peers, like you said, or consult the medical team and say, I'm not really sure about this medication. There are the neofax. There's a lot of different resources that you can do, in order to be ensuring that you are giving something safe to your patient.
Hi, this is Erica. I was just going to add that, as Robin mentioned, the statement has been around for a while. And as a member of the board, one of my positions on the board is to review these statements that are put out and to decide if they're still relevant, if they need it to be updated, or if it's time to just take them off the table. And when I came across the med safety in the NICU statement that was published between 2013 and 2014, I knew that it was still extremely important, and that in those few years, so much had likely changed with technology and new things that were out in the NICU world that we could bring to the statement. So I was very happy and excited that we had the opportunity to work on this and publish a new updated statement.
Erica, you mentioned about technology, and technology, especially in neonatology, is growing at an alarming rate, where there's always new things being developed. And we use technology so much and we rely on it so much. And we do know that it can fail us sometimes. And also, not every NICU has the most up-to-date technology as well. So how did you incorporate technology into the position statement?
So we looked at the literature to really see how much, for example, barcode medication administration is available across the nation. And it's the majority of hospitals do have that. However, as we all know, it may not be specific to the NICU. So, and remember too, barcoding, it's not going to catch all the errors. It mostly catches, the right patient, the right drug, but it's not going to catch the right dose necessarily. That maybe got ordered by a prescriber inadvertently, maybe using the wrong weight for the baby, or using the wrong, patient even from the electronic charting. So, all the 5 rights, there's really more than 5 rights. There's also, right reasons. So technology is a tool, but it's not the only tool. But it's an important tool. So when you have not only barcode medication administration, but you also have our syringe pumps and our dose air libraries, right? How tight are those libraries in terms of helping you program it correctly catching misprogramming errors, those decimal point errors that can happen when you're programming. This is where those pumps can really be integrated into your medication administration process to help you do the right thing and make it hard to do the wrong thing. So that's how technology should work for us. But we all know that things aren't perfect, and sometimes you bypass because it's not working well for you. And that's when you really start to get yourself into a different situation, when you're bypassing the safety checks that are available to you. And maybe that is where nurses really need to advocate for systems that work better for you in the NICU, and integrated medication orders that go integrated into the pumps. Like, there's a lot of technology coming on very soon, integrating into your electronic charting. So we try to bring that forward and really highlight how smart pump technology can help you, but we also know sometimes it's a challenge when it doesn't work properly.
And that's where the mistakes, I think, occur, because there's workarounds for everything. You ask a bedside nurse and they'll tell you how they can work around whatever safeguard, so to speak, is up. But those are there for a reason. And, and we all know with the case that was just out in the media now, there were safeguards that failed or could have been bypassed, so that's why it's important. And I think that this is a great time for everybody to step back and look at their practice. What are they doing, and what can they do to safeguard not only the baby, but themselves? And I think this is a great time to reevaluate your practices as a nurse. Instead of overriding something or doing a workaround, what can we do to make this better? What can we do to make this process smoother and safe for the patients? And hopefully at this time, these issues are now going to come up, and nurses are going to feel comfortable speaking up and saying, hey, this isn't working. And like you said, it's the integration of what's the right reason. I think that would be wonderful if we could somehow get that ability to be able to put that into our technology as well.
I think in adding to the technology, as both of you mentioned, that technology is coming out at an alarming rate. It changes almost daily. There's different practice changes. There's different procedures you have to follow in order to know. And I think it's super important that there's education in place to support the technology, because you can have the technology available to you, but if you've not been educated appropriately, you're not going to know how that technology really will assist you. And it's important that, along with the education, that we create a culture that allows people to question what's happening, allow somebody to look at somebody and say, wait a minute, can you help me? Because this does not seem to be right and I need assistance. People need to be able to say, we need to work on our system because I am stumbling and someone needs to reevaluate what is happening. And also making sure that people are comfortable speaking up is just super important when it comes to medication administration and reducing errors in the NICU.
And Deb, exactly. How NANN had a staff nurse, bedside nurse like Erica involved in the position statement, because bedside nurses should be involved in all processes and updates, including technology, because they're the ones that are using it every day. So instead of having administration and leadership working on these policies, it should be the bedside nurse. It should be the people that are touching and doing this every day. And I think that's important that NANN realizes that and makes sure that nurses are involved in creating these position statements. And also, you mentioned a culture of safety and a culture of being, you feel that it's non-punitive if you speak up, because I know a lot of units, you fear being written up and having that incident report written on you. But it's not about you. It's about the process and how can we fix this process. And I think that they call it a just culture, but I think that that's very important, that nurses do feel power to speak up, because that's the only way that we're going to be able to bring upon change in the processes that we're doing. If we don't speak up and say that they're failing us.
We did add that significantly in the medication safety statement, how important a non-punitive environment is and a culture of safety. So we understand that when events do occur, that those are opportunities to improve the system. And if we don't feel comfortable sharing our event or even a near miss, then we really miss an opportunity to make the system safer. So I think as any staff nurse out there listening, if you can think of it as a systems approach to improve the care of babies, I think that helps us really have a larger lens across some of these safety systems.
So were you able to, in developing the position statement, were you able to determine ways that we can promote a culture of safety, or strategies that would create a culture of safety? So maybe listeners can try to bring that or change that culture in their unit if it is a punitive culture.
Yeah, I think Deb already mentioned one of the first steps is education. We really need to understand what's the most common medication error in our units. Why is that? And the staff need to be part of analyzing these errors, looking at the barriers to implementing or using the safety systems. Hopefully NICUs are looking at their policies and procedures. By using the staff nurses to do that, you really start to create a culture in which we can, safely talk about medication administration and standardize wherever we can. Standardized processes generally promote a more safe process.
And I want to point out the fact that when we talk about medication safety, we're talking about the entire system. We're not talking about nurses administering medications only. It's about the pharmacist preparing, diluting, making the right dose. It's about the provider writing the correct dose. It's about getting the medication to the patient in a timely manner. There's a number of things that impact medication safety. So the RN needs to understand that it's a system. We're not looking at just RNs. We're looking at a system so that the RN can perform to their optimal level.
I would like to add too, I know I work in a larger facility, and my unit has its own med safety committee, and we also have a hospital-wide med safety committee. But if your unit doesn't have one, then as the nurse, you can be empowered to create one. Make your own committee, get a pharmacist on board, a nurse practitioners, your attending medical director, and some staff nurses that can discuss medication errors that happen or potential errors that do happen to prevent them in the future. Our committee meets monthly, and they are a great asset to our unit and to come up with ways to fix some of the problems that are occurring.
I love that idea. And to meet monthly, you're really on top of things, and you have maybe nurses would feel more comfortable reporting issues that they're having surrounding medication administration because there's a core group of nurses working on it, and it's a safe place that they can discuss instead of maybe going to their manager or educator. They can come to the group of nurses. So that's excellent.
The unit I work in also has medication safety committee, and we meet quarterly, and we discuss CS stars, not by pointing fingers, but by saying, hey, how can we make this better? How can we look at our system and avoid something like this from happening again? And I feel it's very non-punitive, which makes it a very good area, a very good platform for people to speak up and say, I stumbled in this particular area, and you need to find a new process that makes this more safe.
Yeah, I think that's great, Deb and Erica both. I think, again, in large units like ours as well, we have those committees. But I think you can start small too, and when as staff report near misses even that, I grabbed normal saline instead of D10, and that's because they were stored together and they look exactly alike. Like, you should celebrate those people with good catches. Like, thank you for reporting. This is amazing, and we want to celebrate the fact that you did that, and do some sort of good catch plan. So then people start to build that culture of safety where you feel, oh, people are interested in what's happening in the NICU, and they did see this as a valuable piece of information, and we did see that they separated these things, so we don't end up grabbing the wrong thing. Remember, so much of our work should consider how human we are. It's easy to grab the wrong thing when things look similar. The same with the recent event in the news with the nurse. She her Pyxis machine wasn't working, and so when technology fails, and you're having to rely on your brain that maybe at 3:00 in the morning needs more caffeine than it's had, and you're really pressed for time and your cognitive tasks are high, you can make these mistakes. So celebrating the near misses help to make that culture start to build.
And it also helps with people, nurses having ownership of what they're doing. And they feel, we've made these changes and these are the outcomes that we're seeing. And I think that inspires people, to work more safely and to work together and hopefully have a better culture of safety, a stronger culture of safety. And the education piece, I think that really is so important. There's so many changes. We talk about the growing rate of neonatology, but medications, there's new medications coming out that we're trialing all the time. And if, we just send out a blast email like, hey, we're starting this new medication or we're trialing this new medication, to make sure everybody is aware, because sometimes not the whole staff knows, and then it leads to questioning, and that just causes more stress. And we all know what stress can do, and that can start causing mistakes. And so I think that that's a very big, important highlight. I know where I work, the color of a medication, they pull out a med and they pre-dispense it in syringes, and it used to be blue, and then now it was white, and it caused a whole ruckus. And all we needed was just a simple email, that this is changing. So, education is really important. I mean, think about all the medications that we use just to treat a PDA, and the different variances that we need to focus on when we're administering that medication. Labs and everything. So it's important that we are educated on that as nurses.
So we also do, in our monthly staff meetings, we call it Take 10 for Safety. And so the last 10 minutes of our staff meeting are dedicated to errors that were reported as near misses, or errors that we felt like, needed staff education. And so that's a great platform to take a few minutes from your staff meeting to discuss some of those things.
Another important component of the system is pharmacy. Not all NICUs have a dedicated pharmacist, but if that is an option, that is something that I just really cannot express how helpful a pharmacist can be throughout the entire process. They may not be the one mixing it, but they're the one checking to make sure that it's correct. And I, as a provider, am super appreciative when they call and say, hey, you need to check your order because this is not really what we wanted to order. And so that kind of like stops it from even getting to the bedside through the pharmacist before the nurse has to say, hey, wait a minute, what did we order here? As a provider, I'm super appreciative of everybody down the line that is going to look and question what I'm doing. Because in the end, it's the baby that matters, and their future is dependent on our care. So it is super important that we create this non-biased culture and be safe moving forward.
Such a good point, Deb, and it always brings me back to how the NICU patient deserves redundancy in our safety checks. It's not going to just be one part, right? Because we need redundant systems. You have the pharmacy is checking. You have your pumps that are checking, you have each other to check. These are all redundant systems because the NICU patient's very vulnerable, and we know that they have more errors than any other patient in the hospital. They experience more medication errors, and they experience more harm from those medication errors. And the younger they are, the more errors they actually experience. So we really have a duty to protect them and ultimately protect us as well with these redundant systems. So I can't speak enough about why multiple systems of safety help keep the patient safe in the NICU.
Yeah, because ultimately the nurse is the last check of that medication before it hits the baby.
I think when we're talking about medication safety, we have to look at the whole system of the medication process, and we have to consider how can we reduce risk factors, such as how can we reduce risks of an emergency, giving a medication in an emergent manner with bypassing some of those strategies. It's very important that when we have a system in place that we follow the system in every aspect. Nurses could be stressed, they could be distracted. As we've mentioned before, there's a lot of workarounds. And we're human, so we need to really stop, think, and then act before we move forward to reduce the risks that potentially could happen with medication in the medication administration process.
Jill, I think also we have a section on the fact that there's not one single intervention. The literature supports a multi-pronged approach to improving medication safety. So I think especially people who don't have a lot of resources, that there's ways that they can get going on making things a little bit better. Like Deb just said, you can standardize when possible. Like there's ways to standardize emergency medication administration. And if you write it down and we all practice that, you standardize. So checklists, technology alone. If you over rely on technology, you're really reducing your ability to provide safety. So it's not one intervention, and I think that that's an important take home as well.
I remember when I first started, we did a lot of medication calculations when we had infusions running to check. And I think we've started to shy away from that because everything is computerized and everything is a guardrail on a smart pump. So, there's a lot of things that we've sort of stopped doing because we're relying on technology, like you said. So, that would be something that would be good to bring back into practice to check that those infusions are correct.
Yeah, we refuse to drop that because you might be on transport and
exactly it's a lost art. And I think sometimes the nurses that don't do that or haven't done that, it's like, all right, there's your education, Deb. Like that's what we have to make sure that we're educating people, because God forbid the computers are, what do you call that? Go down, or they do an upgrade, yes, and you don't have Epic or whatever computer system for a whole shift.
Yeah, over reliance. That was at the core of the mistake too. There was a breakdown and a bunch of problems with that Pyxis issue that she had, but over reliance on technology, and we really need a multi-pronged approach. So I think that's an important, because people are putting all their eggs in the technology basket.
Exactly.
I agree. And when technology fails you, such as if you have a new medication on your floor and the guardrail's not set, you have to override that guardrail. Mm-hmm. You've got maybe pharmacy and your provider standing behind you saying, no, go ahead, do it. And the nurse sitting there saying, I'm not sure because it's not here. And they need to make sure that they are educated on a medication prior to it becoming live, so that they can be safe. Putting people in a position where they don't have the resources to be safe is as bad as a punitive environment when people don't report their mistakes.
And hopefully that's where, as you mentioned, the standardization it will be able to help. I think, if you ask some nurses, how long would you run this medication? If they didn't have a pump, I don't know if they would be, I think you would get different answers from different nurses.
Yeah, I mean, just as simple as how do you give ampicillin that we give all the time. You could ask different nurses, they're all mixing it different or whatever's happening. You can standardize that. You can integrate that standardization into your Epic MAR, and it can give all those instructions right there. So there are ways. It just really takes leadership to kind of help standardize these processes. But ultimately it comes down to a safety culture. Like, you have to see that this is valuable.
Yeah, I just wanted to point out one of the recommendations in the position statement by NANN is that medication safety should be identified for competency for all staff in the NICU and be included in the orientation of all new hires, as well as ongoing annual education.
Yeah, we do it annually here. You'd be surprised, how people have lost some skills, definitely.
Exactly.
Yeah.
Exactly. And I think, as horrible as the situation that occurred, that case, I think it really has brought to light medication safety. And I think it's really making all of us reflect on our practice and the importance to our patients and to ourselves.
Yeah, Jill, I don't know if you remember this. You're kind of young, but in 2008, I think it was, there was a heparin error that occurred and
Yes.
Yeah, several babies died, and that unit wrote about their experience, and they sort of recommitted to the safety of medication checking after that. So remember, that all came through the Pyxis being loaded with the wrong concentration of heparin. So when it was before, I think, barcoding was really everywhere, but either way, they weren't really looking at their vial, right? And so to hear, that was heartbreaking to experience that, I'm sure, for those nurses, but it wasn't that long ago. And we had a few cases here in California as well, related similarly. So these are cases where, medication safety was really at the forefront, and unfortunately babies died because of those errors.
But there was change that came from that. I remember, big changes that occurred.
Yeah. People re-looked at their use of heparin.
Yeah, and I know the labeling changed, the coloring changed. It was a lot more obvious.
Right.
Yeah, so and hopefully that's what this is going to inspire people to make change. And hopefully hospitals will take a close look at the systems that they have in place and make change. Or empower nurses to speak up and maybe look at their culture and how can we make this non-punitive.
Yeah, and I think when you're on transport, like that nurse was transporting a patient, and we're out on transport, what systems can we put in place there when we're out and about in the ambulance?
And as Deb mentioned, in an emergent situation, in the delivery room, you're coding a baby and someone hands you a medication, you think it's epi, but that needs to be standardized. And, and that's when the most error can occur. When, high stress, lots of noise, lots of interruptions, or into a unit code. So, whatever kind of safety measures that you can put in place.
And we commented on that because Deb wrote this section, was that the superior learning that she found was really a team approach to learning. So, simulation is a great example of how to standardize the administration of epinephrine. And that way we're all just doing it by motor memory,
And when we're talking about emergencies, we experience codes in the NICU, I wouldn't say on a regular basis, but often enough that we need to be educated in that area. And one thing that I find very helpful is in our mock codes, we have people shout out, I have epinephrine, this is the amount I have. And make sure that the people standing at the bedside agree with what she has pulled up, because it's important that we don't give the wrong dose. And that's a check for everybody there, because There's not commonly a pharmacist there. No one's making your medication. You're pulling it up all by yourself. So we need to be able to, in this systems approach, say, hey, I have epinephrine and this is how much I have. Is this what you want?
Yeah, almost like a timeout. A mini timeout before you administer the medication. This is the patient's weight, this is the dose, this is what I'm giving, or this is what we have.
In our unit, we actually have a situation where we have a transport nurse that will come and help us in deliveries. But if we have a higher level or a code situation, they add another nurse called a code nurse. So there are two people that can be working simultaneously and working together in order to make the situation more safe.
That's great.
That's amazing.
And that's dedication to patient safety right there. So, Robin, what are some ways that nurses can support medication safety in their NICU?
Such a great question. And I think ultimately we all have a responsibility to sort of step back and look at our own practice and say, okay, how can I be safer tomorrow? What can I do tomorrow to make my practice safer? And I think some basic things can be done immediately, which is to not bypass the safety checks that you do have in place. They might be limited where you work, but and they may not work great, but use those guardrails on your pumps. Make sure you know it's not just 5 rights. You know, it's also the right reason that baby's on that medication. Understand and reflect on the fact that you are human. And so being vigilant for long periods of time is really difficult for our brain. And so when we're tired or when we're overloaded with tasks, we really need to ask for help and advocate for our coworkers to help us be safe. Double check us when we need that. And again, I think it's a commitment that we personally have to make. None of us wake up in the morning and say, oh, I know I can't wait to make a medication error today. Those things happen, and 95% of the errors that do occur are to very safety-conscious healthcare providers. So understand that we work in a system, and that system can help us, or that system can really make it hard. So be vigilant and advocate for yourself. You know, reduce your distractions. When you're in the middle of medication administration, that's a really high-risk activity. So reduce distractions. Ask people to talk to you after you're done. Try to explain to parents before you get started with medication administration that this is a high-risk activity and you want to be really focused to protect their baby. So these are all ways to sort of advocate for yourself and create that nursing practice that is really focused on safety. Remember, the babies we take care of are at the highest risk for a medication error in the entire hospital. And the younger, the more at risk they are and the more likely to have harm. So we really want to spend our time and our mindfulness on how to be safer in giving medications.
Those are such helpful tips and something that you can do today, and something that, and you know, Erica and Deb gave us some great insight and examples that they use in their unit. Medication safety committees on their unit, but they're all very easy to establish. So, you know, I hope everybody takes what they learned today to bring that to their unit. And, you know, what are you going to do differently that's going to help your babies and yourself today? So thank you all for joining me today and to talk about such an important topic for our babies. I would like to thank our sponsor, Centec. This podcast would not be possible without their support. Make sure you never miss an episode of NANNcast by subscribing now. This podcast is made possible by listeners like you. Thanks for your support and letting us into your ears. Have a great day.